Greetings, we're here with Commissioner Cunningham, the Office of Addiction Services and Supports. Nice to have you.
Yes, nice to be here.
I want to tell you why we're here. The main reason why we're here is because your workforce is simply awesome. The level of attention, the passion, I teach financial wellness, and many times the financial issues go beyond just credit and budgeting, but they also go into exactly what you all are dealing with every single day. In one particular case, a member that I was working with could not get her debt paid off, mainly because her husband was addicted to gambling. Every single week, I didn't understand why we couldn't get that $20,000 debt level down. Every single week, we were trying to get her budget together, but find out her money was going to playing numbers. And so that intrigued me as to what we can do to provide solutions, and your hotline came into play. We called the hotline, and I want to give a shout out to your workforce now. They were motivated, they were passionate, they were professional. To say I was impressed was just, it's not even enough words for saying how impressed I was. They called back multiple times even to check on them and provide resources. So let's talk a little bit about Oasis. And first of all, how long have you been commissioner with Oasis?
So I've been the commissioner for about a year and a half. And prior to this, I spent really the vast majority of my career, over 20 years, as a physician, practicing medicine in addiction. So seeing patients, developing programs to help improve access to care for people who use drugs, and then also doing research to try and figure out how we can deliver care better.
And so with that every single day, what I've found out about Oasis, and just not only just researching you, but actually working with you, because it's necessary between substance abuse, between addiction to gambling, and all the addictions that we face every single day. They cause so many financial issues, so what you're doing is such a valuable component of the community. Can you talk a little bit about your prevention framework? Exactly what does that entail? Because coming out of COVID, even I had my own personal story of 8 deaths, a lot of isolation, a lot of depression, dare I say. First time I've admitted that publicly. But understanding that sometimes on that Friday, my vice was champagne. And I didn't realize it at the time, but it became to be my dependency.
Yeah.
And so I had to stop. And luckily, it was my mother who intervened. You all do a lot of intervention work, and said, Ryan, you're doing Friday night champagne very frequently. So talk a little bit about that prevention framework and stories like mine and so many other millions around the state of New York that you're dealing with.
Yeah, so I would start out by just saying that our office really focuses on prevention, on providing services that are for prevention, treatment, harm reduction, and recovery. So it's really the whole spectrum. So to prevent and address addiction and substance use and gambling. And so I think one really important point here, and so glad why we're having this discussion, is because stigma is a huge issue. So there's a ton of stigma in our society around addiction. And sometimes there's also stigma around the treatment for addiction as well. And so I think having these conversations out in the open, instead of in the shadows, instead of, the sort of secretness, the shame that goes with this, it's so important to sort of get this out in the open. We know that, addiction is a medical condition. The brain gets rewired. We know that there's effective treatment, but there's no cure, and it takes lifelong management. So depending on what the addiction is, if it's to drugs or alcohol, there are medications that are effective, and often they can be very, very helpful, and sometimes people need to take them for their whole life, and sometimes people don't. It's up to the individual, and it's really about meeting the individual needs and being able to provide a whole continuum of services so that we can match the needs of the person and provide those services.
I'm glad you said that, because even as I was telling you that story, there was something that was in me not wanting to say it, right? It was something that's in the core saying, don't talk about that.
Right.
Or so there is a stigma.
Right.
And it's almost like I've been trained, amongst many other individuals who've been trained to not even open up about the struggles that we're going through.
Right.
How have you found, especially with the Megans of your hotline, that again, shout out, man, it's such a great service you're doing. How have you found they've been able to break down those barriers to get through to actually start becoming open? Is it the passion? What's the mix? What's the formula?
Yeah, absolutely. So the people come to do this work because they are passionate and committed to doing this work. I mean, that's something that I have to say I've definitely found since the first day that I became commissioner. It's not just another governmental agency. People are here for a reason, and there's a lot of addiction. Most of us have somebody in our family or in our coworkers or our neighborhoods, right, where we know somebody with addiction, and so it's personal to a lot of people, and really wanting to be involved in the solutions and in the help. And so I think one of the key parts about the HOPEline, as you mentioned, is addressing addiction in a non-judgmental way, right? Recognizing it's not about an individual person being weak, or about their willpower, or about having a moral issue. It's a medical condition. And we need to think about it like that in the same way we think about diabetes or heart disease, chronic conditions that require behavior changes, and really require lifelong management. And we know that changing behaviors is hard, right? We all make resolutions at the beginning of the year. How many of us stick to them, right? It's hard to change our behaviors as human beings. And so, providing the support to be able to do that, doing that in a non-judgmental way, recognizing that it's hard, recognizing that it's not a personal failure, but it's a medical condition, and approaching it in that way is really an important part of the work. And, what I would say too is that approach is really a harm reduction approach. That's a word that, or a phrase that now we're hearing more and more. And harm reduction is really focusing on providing non-judgmental services, recognizing that addiction exists, meeting people where they are, trying to help people move in a healthier way, not necessarily just only about abstinence, but really helping people just get healthier wherever they are on the continuum of their addiction. And providing services that are very accessible, that we don't have barriers, and that people can get those services kind of on demand when they want it. And so that's why the HOPEline, which is available 24/7, is really an important part of that.
Well, to talk about that particular case I'm thinking about, the husband was adamant that he had no addiction problem. He was mad that me initially even brought it up. And that's why I had to call the HOPEline. I said, I need some help to have this conversation. I'm not trained to have this conversation. And it was because of the Megans and the other counselors that you all have that were able to have that. You said the term was harm reduction. Okay, well, the way that she approached it, obviously, is above my pay grade in terms of the communication style and strategy, allowed him to have his walls and his barriers broken down.
Exactly.
He was no longer as upset. He was no longer angry. And it became more of a dialogue of okay, let's figure out what we can do to help. And then here I came in to support the Megan, right? To say, now here's the budget. Here's how it's impacting the budget. But we all know the financial issue is just a symptom of the problem. Right. It's not the core.
Right. And
so I just say, man, the HOPEline is such a phenomenal help. Because let's talk a little bit about, I know there's a buzzword going in there of fentanyl, and that's been a problem in the community, but it seems like now it's becoming traction in terms of the mainstream media of discussing it. How has that impacted the state of New York, and how are you dealing with, and opioids as well, how are you all finding that fight and the struggle has been to fix that problem in New York State?
Yeah, absolutely. So this is really the biggest, I think, crisis of our generation, besides for COVID. We are experiencing the worst overdose death rates ever in history. That's happening in New York State. It's happening in the United States, really across the board. More and more people are dying than ever before of drug overdose. What is really driving that is fentanyl. And so fentanyl is a very, very powerful opioid, and it's really found now in all substances. So it's in heroin, it's in cocaine or methamphetamine, it's in counterfeit pills. It's really in any substance.
And what exactly, because call me a novice on this, because this is not my lane at all, but fentanyl, is it a man-made substance? How is it created? So is it put in multiple drugs? I'm seeing it all the time. What exactly is it?
Yeah, so it is a class of opioids. So opioids include things like heroin, morphine, and oxycodone. And so fentanyl is in that same class. It is man-made, so it is synthetic, and fentanyl has been around for decades. It's something that doctors have prescribed to patients with really terrible pain, usually saved for people with cancer pain, for example, really, really severe pain, because it's such a strong opioid. So it is something that has been around and been used medically, but now, really over the past few years, we've seen it in the drug supply. And so what fentanyl does, what really all opioids do, is if you take too much, or if it's sort of really potent, it reduces the drive to breathe. So it slows down breathing.
Whoa.
And ultimately breathing will stop, and that's how people will overdose and die.
Whoa.
And so that's how fentanyl is really driving this epidemic. And I think one of the important things is the epidemic has been really coined as the opioid epidemic, and that is true, that the majority of the deaths have occurred in people who use heroin or who use OxyContin, that kind of thing. But more and more now, we're seeing about half of the overdose deaths involving stimulants, so like cocaine. And people sometimes think that, that's those people who use heroin, that doesn't apply to me if I just use cocaine on the weekends or something like that. Fentanyl's also in cocaine.
Wow.
And so what that can be deadly. And so we really want to make sure that people understand it's not just about opioids. It's not just about heroin. Fentanyl is in the drug supply, period. And so people need to know that. We have tools to be able to address that. So we have fentanyl test strips. And those are things so that if someone is going to use cocaine, for example, they can check to see if fentanyl's in it. And if that's the case, they may decide not to use it. They may decide to use half of what they would normally use. They may decide to have naloxone, also known as Narcan, nearby, because that's also another tool that if somebody overdoses, you can give them the naloxone and you can save a life because it reverses the overdose. So there are tools out there that are harm reduction tools to make sure that we just keep people alive first, and then can link people to more services and to treatment when people are ready. And so those are available on our website at OASAS, where people and programs can get access to naloxone all across the state, can get access to fentanyl test strips, and they're really able to be used so that people can save lives.
And that was the impressive thing about your site. Again, it's a conglomerate of resources, local community-based organizations on the ground doing work, but also things like the test strips that you can offer, and also the testimonials. What's the value of hearing a story of someone who was able to get out of the struggle that you're facing? What's that value?
It's huge. It's so important. And so we know, so data and science is really important, but we know that that's not enough. We know that it's about the human connection, right? It's about stories that really, touch us as human beings. And because stigma is such a big part of addiction, really hearing people's stories is such an important part of really breaking down the stigma, to say, oh, well, if it happened to you and you were able to be successful, then I know that I can be successful, or I know that my loved one can be successful, and that there's hope. And there is. And so, for example, for people who have opioid addiction, we have really effective treatment. We have treatment that reduces the risk of death by 50%.
Wow.
There's not that many other things that we do in healthcare that have that kind of results. But if there's stigma and nobody knows that you have addiction, or if you're worried about sort of bringing that out into the open, then you're going to be less likely to actually get the treatment that you need and the treatment that can save a life. And so that is really such an important part of the stories is there is hope, there is treatment, it is effective, and so that people can get their lives back.
Awesome. Well, I definitely want to give thank you for your time today. I think the work that you are doing is a godsend. It's tangible. It's comprehensive, as you said, and the website is phenomenal, and the HOPEline is phenomenal. Any closing thoughts that you would just like to give encouragement for someone who's going through alcohol addiction, drug addiction, gambling addiction? Any encouraging words you want to leave before we close out?
Yeah, absolutely. So there is treatment, and treatment is effective, and it's available. And so, by calling the HOPEline, which is 877-8-HOPE-NY, or texting HOPE-NY, or going to our website at oasas.ny.gov, there, any of those ways, you can easily access resources, get linked to services, and get your life back together. And so there is hope, there is treatment, and it is effective.
And it works. I have to, the testimony, I've seen it in action. Thank you for your time today.
Thank you so much.